Hey everyone, it's group 4 here. We have our presentation split up a bit, so at the beginning, here's our slide if you want to take a look at it, and then we'll be splitting it up throughout the presentation. I hope you enjoy. Please forgive my dogs, they got a little bit antsy after all the filming. And here's our references.
Hi, I'm Charlie.
And I'm Uncle Joe. Since we are doing a different format than most people, for readability and so that you can see my adorable face at the same time, we split our presentation into separate slides.
Today we're here to talk to you about animal-assisted intervention.
We think that all kinds of animals are great at making people feel better in so many different ways.
That's why we picked our research question, does a species of animal in animal-assisted therapy produce different results on the behavioral states of dementia patients in nursing homes?
Not everybody thinks that I'm cute. That's just crazy talk. Look at how distinguished and handsome I am. I mean, I'm wearing a blazer for goodness sakes.
And some people are scared of me, even with the pearl necklace, and I'm super duper pretty.
Since we aren't biased about helping people, we wanted to find evidence that different kinds of animals can help people with dementia. Elderly patients with dementia often have many comorbidities and polypharmacy, so any non-pharmacological therapy to improve the quality of their lives needs to be investigated.
We looked at 2 different research studies that were trying to find empirical evidence that horses or doggies like me could improve the behavioral states of dementia patients.
The first article we consulted was called Effects of Dog-Assisted Intervention on Behavioral and Psychological Symptoms of Dementia. This study was published in Sweden in 2014. Sweden has a remarkable program for dog-assisted interventions, or DAI for short. Those Swedish dogs have to go to a special school with their trainers before they can start their careers.
You mean they don't just go to nursing homes and look pretty?
No, they work full-time with their handlers. They have specialized training to help residents with their memory, communication skills, or even solve problems.
Okay, now that we know the background of the study, what's the purpose?
The researchers were looking to see how DAI affected dementia patients over a 6-month time frame. Their research question was, does dog-assisted intervention affect behavioral and psychological symptoms of elderly patients with dementia?
The independent variable is the dog-assisted intervention. The dependent variables are behavioral and psychological symptoms, and the population are the patients with dementia.
The sample of this study included 33 patients. 13 of them were in the control group and 20 of them were in the experimental group. They came from 8 different nursing homes all over Sweden. Unfortunately, 9 of subjects passed away and 5 moved to other facilities.
But weren't all of those patients at risk for diminished capacity since they have dementia?
Actually, Charlie, these researchers took that into account and the Regional Board of Research Ethics in Uppsala, Sweden approved the study. Researchers consulted a close family member who knew the subject well and could describe their thoughts, feelings, and wishes. Family members were given informed consent verbally and in writing. The researchers took into account the subject's opinions and views for decision making. Family members and subjects were not obligated to continue in the study if they did not feel safe to do so. Participants were continuously monitored throughout for any objections towards the study.
Sounds like they knew what they were doing. What were the inclusion and exclusion criteria for the subjects?
The inclusion criteria were a diagnosis of dementia and that the resident had to live at the nursing home for at least 4 weeks. Exclusion criteria included allergies to dogs, a history of aggression or agitation related to dogs, or a history of getting upset when meeting dogs.
So how did they actually do the study?
The researchers used a quasi-experimental, pre-test, post-test research design. All subjects in the control and intervention groups were tested for a baseline of their behavioral and psychological symptoms of dementia levels, or for short, BPSD levels. Examples of symptoms are verbal and physical aggression, wandering, or oppositional behavior. The instruments used to rate BPSD were the CMAI and MDDAS. Both scales were filled out by the caregiver regarding the agitation and behavioral or psychological symptoms respectively. The intervention group had their BPSD assessed after every therapy session. Both groups had their BPSD levels assessed again at 3 months and 6 months after the initial baseline assessment. The actual interventions were 10 45 to 60 minute sessions of DAI therapy. They met once or twice a week. All sessions and goals were tailored specifically to each patient. Sessions involved walking, playing with the dog, petting and feeding the dog treats, talking to the dog, brushing the dog, or reminiscing about previous pets or talking with the handler.
What did the results of the study show?
The study did not yield much statistically significant data. The verbal agitation score at 6 months was the only significant statistic that showed improvement. The alpha was a 0.05 and the p-value was 0.035. The rest of the measurements were not significant statistically, but the subjects were noted to have looked at pictures of the dogs after the experiment and told fond stories about them. This study shows that dog-assisted therapy may be complementary to reduce behavioral symptoms in people with dementia.
How does the article support your research question?
This article shows that there are positive correlations to animal-assisted interventions. The authors in our group were able to see strengths and limitations to the study. We can see ways to improve the current study or incorporate some of these strengths into future studies.
Our second article was about AAT using horses. It's called Equine-Assisted Intervention for People with Dementia. The researchers sought out to see if it's feasible or effective to utilize guided therapy with horses to improve physiological and behavioral states of the patients with dementia.
The IV was the horse therapy, and the DV are the physiological and behavioral states, and the population would be patients with dementia.
That's right, Job. The convenient sample used by the researchers had 16 residents with dementia. Participants were randomly assigned to be part of either the experimental meadow, n=9, or the control Glen program with n=7, and both programs include individuals with dementia diagnosis of 16 patients total from adult health care centers. The male to female ratio of the study population was approximately 1:1. Inclusion criteria included patients' ability to ambulate by walking or wheelchair, patients receiving a stable regimen of medications including psychotropic medications, diagnosis of early to moderate stage Alzheimer's disease or dementia. Exclusion criteria were not identified in the article. Ethical considerations included consent by both participant and the healthcare proxy, and participation was voluntary, and participants were also able to withdraw at any point during the study.
How did they measure the interventions?
Well, they used 3 different tools to measure the effects of the horses. First was the Philadelphia Geriatric Center Affect Rating Scale. This allowed for a consistent definition of affective characteristics such as pleasure, interest, and even anger and sadness. Second was salivary cortisol levels. Cortisol is a stress hormone and was monitored to identify quantifiable data regarding individual stress levels. Finally, they used a modified version of the Nursing Home Behavior Problem Scale. This scale was used to help inventory behavioral problems such as resisting care, loss of temper, and fidgeting. The authors did not give a detailed information regarding the way in which the scale was modified and is not provided in the study. This modified scale included the mini mental state examination to verify cognitive status of participants in activities of daily living and instrumental activities of daily living. These scores were utilized to identify the type and degree of therapeutic intervention. The tools were used and assessed weekly before and after therapeutic intervention. Research assistants were trained in the use of the above tools for the purpose of this study to ensure reliability and validity of observational recordings.
So what kind of intervention activities did they do in this study?
Subjects did all kinds of fun activities, like learning how to groom one of the 4 horses used in the study, observing horse-to-horse interaction as well as participant interaction with the horse at the participant's discretion. They learned about the anatomy of the horse and how to apply a halter, and they even were allowed to take pictures with the horses. Participants were also educated on Native American practices regarding protecting their horse via painting and tribal symbols of the animal. Participants were then allowed to take turns washing the horses, the final activity of this encounter including providing hay to the horse as a way to thank them for their participation. Subjects were observed and findings were recorded regarding their behavior and effect every 30 seconds over the course of the 15-minute sessions in which the participants groomed and painted the horses.
So what did they learn from this study?
Well, participants were actively engaged in the grooming and care aspects of the horses. They seemed to respond very enthusiastically to this part of the intervention. There was a notable decrease in participation when activities included painting the horse, which is directly associated with the participants' concerns that the animal may not be enjoying the activity.
Yay for concern for the horses. I want to know about the saliva. That seems to be your specialty, Charlie.
Funny. They found that there were significant differences between groups that had higher versus lower MMSE scores. Higher MMSE scores were directly associated with statistically significant increase in cortisol levels when attending the farm compared to their usual activities at the center. This is likely because cortisol levels increase with stress, and stress doesn't necessarily mean distress. The researchers believe that this increase in cortisol levels is an indicator of good stress in this group of individuals and for the purpose of the study. Lower MMSE scores were associated with lower cortisol levels at the farm, but this data was not statistically significant. There was no significant difference between these groups of participants when they spent time at the center doing the regular scheduled activities. Overall, the scores decreased after participants visited the farm, showing a possible relationship between visits with the horses and decrease in undesirable behavior.
Now I'm going to talk about our conclusions. Both articles had limitations as far as sampling was concerned. The first article lacked randomization and used a very small sampling size, which translates to external validity problems within the study. The second article also lacked randomization and contained personal bias when selecting participants and pairing selected therapies with them. Despite their limitations, both studies came to the conclusion that the use of animal-assisted therapy did show a possible relationship with decreased behavioral difficulty in the dementia patients, although neither really yielded meaningful statistical data. We propose a study that uses a variety of animal species to assess possible relationships in the animal type and to see how effective that animal-assisted therapy can be.
Recommendations. We recommend using a larger scale study so that its results may provide more external validity. To standardize the animal-assisted therapy so that all participants receive equal care and bias is minimized. To reduce attrition rates, the study would begin at the beginning stages of the disease, minimizing chances of mortality. The intervention of the study would use a variety of animals to assess the differences that the species of animal has on the results of the animal-assisted therapy. A randomized crossover design would yield the most valid and reliable results.
Those sound like some great recommendations, Charlie. We should be in a study as long as we get paid in treats.
I agree. Thanks for listening to our presentation. These are our references.
No Weimaraners or pugs were harmed during the making of this movie.